our discussion today. Kasama, of course, si Dr. Emely
morning.
Sevilla, ang ating suking teacher.
Yes,
Ayan.
great
And,
to be back.
and lifestyle and weight management specialist. Opo po kayo, Miss Dr. Emely. Ito guys, ang pag-uusapan natin ngayon ay bagay na bagay sa mga taong super busy o kaya ay wala ng panahon para mag-exercise. So alam niyo na kung bakit sa akin binigay itong topic na to, di ba? So ayun Doc, yun po ang ating pag-uusapan. Pero I just wanna ask po, no, kasi karamihan talaga sa mga tulad namin na maraming ginagawa or sa mga kasambahay natin na ang dami-daming ginagawa, ang laging mindset is ipapahinga ko na lang kesa mag-exercise. So ano po yung dapat gawin para maiba yung ganung klase ng mindset?
Okay. Me kasi, I'm also a lifestyle and weight management specialist. So aside from being an anti-aging and aesthetic physician, I also manage weight through fixing their lifestyle. Because we have to be honest to ourselves. Everybody is actually really busy nowadays. And the problem is, being busy, you get very tired.
That's
and
true.
you don't have energy anymore to do some exercise. But then if you understand the benefits of exercise and you are actually willing to do it as a habit, if you develop it as a habit, then it would be so easy for you. It's just like going to the bathroom and taking a bath. So, sa napansin ko kasi sa mga patients na tinitreat ko with weight management, weight control, body sculpting, body contouring, napansin ko lang na if they don't develop the habit, the desire would die down. Once the desire would die down, they would disappear and they would stop exercising and dieting. If you notice, parang kaya patok na patok ngayon yung fad. Alam mo yon, yung tipong heightened up ka. Uy, gusto ko to, gusto ko
mo
yan.
subukan.
Uy, may lumabas na ganito, bagong ganyan, bagong ganon. Instant, like 1 week, 2 weeks. Kaya patok yung mga ganyan eh. Kasi most of us, we cannot sustain the desire or the willingness to be putting it really in our lifestyle, understanding the effects of exercise in our body, in our health, na mag-extend ito ng ating mga buhay.
Actually, very guilty. I just wanna say na very guilty ako doon sa sinasabi ni Doc na parang at first I will try something na kumari may napanood ako na simple exercise, susubukan ko siya. But the problem is yun nga, my mindset is hindi sustainable na parang gagawin ko lang siya for a couple of days.
Exactly.
Pero afterwards, nawawala na yung
Oo.
desire to work out. Reens?
You explain to them na kahit stress ka, pwede ka mag-workout. In fact kasi, nag-release ka ng mga chemicals, certain chemicals
Yes.
like dopamines, di ba? You release it, it makes you happy, di ba?
It makes you happy.
Serotonins,
Oo.
mga ganon.
Yes. Probably, yun nga yung sinasabi ko. That's why I'm a lifestyle and weight management, because they don't understand what the real effects of exercise is to their body. So parang iniisip mo pa lang na pagbubuhat ako, maglalakad ako, tatakbo ako,
Napapagod.
napagod ka na. Actually, ini-imagine mo pa lang pagod ka na. So matutulog ka na lang. Diba? Your mind is already tired. Your mind has already exercised on its own. So, yung approach ko to this generation is lifestyle change talaga. You make it a habit. You do it every day for 5 minutes at first, and then 10 minutes, and then 30 minutes a day, parang ganon. So that to keep you going back to that kind of habit, parang ganon. So because if you kind of lose it, then wala na siya.
Kumbaga, Doc, parang gradual introduction nung mga exercises na pwede mong gawin. Huwag mong bibiglain. Kasi ang tendency, either ma-burnout ka or mapagod ka at hindi mo matutuloy-tuloy.
Exactly. I have one patient who bought all these equipments, who bought treadmill, who bought a bike, who bought everything. And then, all of a sudden, after 2 months, when I saw the equipments, ang dami ng sampay. Ginawa na lang sampayan. Diba? So that's what happens. It is reality and everybody can relate to that. Diba?
You don't need to go to the gyms naman. Di ba tama naman, Doc? Like for example, kunyari puro sitting down yung trabaho mo. Pwedeng once in a while you walk. It's a form of exercise din, di ba?
That's true. I worked with an American company before who's doing call center, The problem with them is they have low back pain because they sit down all throughout the day and then they slouch on their chairs. So yun yung problema. So they end up having back pains, having joint pains because ito ang break time nila. Yossi.
Instead of doing something active.
So you know what we did to them? I did a lifestyle seminar and then parang quick exercises for them. So they would just bring bottles of water, like for example, alam mo,
Simple
meron akong nakita.
exercises.
Oo, meron kasi akong nakita dun sa parang fitness store na nung una kasi ang ginagamit namin, water lang, parang Wilkins sa 1 liter, parang gano'n.
Oo, bottled
O
water
kaya,
lang.
bottled water lang siya. Tapos, puno lang siya ng tubig. Tapos, yun na yung gagamitin mo. So, you don't have to bring your barbells in the
Yes.
office. It's so
Hassle pa,
nakakahiya.
magastos pa.
Exactly. Oo. So, your water, you just have to refill it and then you can use that already as your weights. And then a little bit of stretching, di ba? Yung mga stretching natin. So there are a lot of simple stretchings that you can do also.
May gusto lang ako ipakita sa kanila kasi there are some offices also in the Philippines who uses this na, yung parang nagme-medicine ball na sila instead of chairs,
Oh,
di ba?
that's amazing.
Parang nag-workout
Sorry,
din.
anong nagagawa ng ganyang ball sa
Yung
tao?
core mo,
Balance.
nasa-strengthen mo.
Kasi
balance.
you need to
Oo,
balance.
yung balance.
Oo.
Yeah.
Because
So instead of chair, medicine
Exactly,
ball.
yes. Because if you use a ball because if you notice, a chair is a stable object. Even if you go slouch in that, even if you don't fall, diba? If you do it on a ball, if you don't, yes, proper posture,
Yes.
kasi that's very important. I taught them that also. You have to do your proper posturing, and then if you're tired already, you can do some stretching. Kasi if you sit on a ball, you have to balance yourself. Kasi hindi siya stable eh.
Yes.
So it exercises your core. And do you know that your core is the center for diseases? So if your core gets bigger, then comes hypertension, diabetes, all those kinds of things. So it's very important for your health as well.
Dok, kasi meron ako mga kilala, parang ang bilis nilang hingalin kapag nag-exercise sila. So parang, kaya hindi nila sinusubukan kasi lagi yun ang excuse nila, hinihingal ako agad eh. Meron ba mga certain exercises na bagay ibigay sa kanila at first?
Actually, we call it endurance.
Oh.
The problem is, if it's your first time or you're not used to exercising, your body's response, like for example, yung lungs mo, kukonti lang yung kaya niyang i-expand. Kasi hindi naman siya sanay na huminga ng ganun kabilis. So that's the reason why I told you na you have to take it slowly on a daily basis. You have to desensitize your body. You have to train your body so that you will be able to create endurance and then strength. So yun. Kasi pagka once na may endurance ka na, you develop strength eh. And then you will notice, it will do great things to your body as well. You would feel hindi ka masyadong pagod, hindi ka masyadong parang lamyang-lamya. Because yun nga, you have hormones that your body will be releasing. And then at the same time, for beauty, you will not sag. You will not easily
Matutone
sag.
kasi.
You will be toned.
Yes.
Tapos when you sweat, your pores would open and then it would release some toxins inside your body. You would also glow. Kasi your skin is, yung moisture galing sa body mo, yung sweat mo lumalabas so that you get a good moisturization also. So it makes you beautiful also. That's why if you notice, when you exercise, your cheeks are glowing even without blush,
Blush on. That's
diba?
right. Oo.
Iba yung glow mo.
Question. Kasi people usually choose between cardio or just muscle, just
Yes.
to tone. Which would be a more preferable form of exercise? Is it just if you can just concentrate on cardio? Would it just be cardio?
Actually, it has to be a combination of both. But then, for first-timers, we really encourage cardio muna. Because you need to develop your lungs, you need
Endurance.
to develop your heart. Because when you exercise, your blood pressure goes up. Your heart rate, your respiratory rate, meaning yung paghinga mo, bumibilis din. So everything goes up and your blood circulation is like, wow, it's going so fast also. So that's why you have to do cardio first. So para masanay yung katawan mo. And then pag medyo okay, kasi if you notice, there are a lot of, narinig niyo na ba yung mga muscle tears? Yung sa
Yes.
gym,
Yes.
sobrang na-excite. Niyaya ng kaibigan. O sige, buhat tayo. Pumunta sa gym. First time niya. Okay.
At hindi
So,
pa nag-stretching.
Hindi
diba?
pa
Maraming gumagawa niyan.
Walang personal trainer. So, hindi niya alam. Na-excite lang siya talaga. So, motivation lang. So, nagkanda punit-punit yung muscle niya. And that happens, micro tears in your muscles if you're not properly tuned para gumawa ng ganong klaseng hard exercises. That's why you have to do cardio first. And then pag nasanay na yung katawan mo with the height of blood circulation, respiratory rate, and then your everything, so pag nasanay na siya, you can do some toning. So pwede ka nang usually po, ang ginagawa po natin para safe tayo, machines muna. Di ba po meron tayong tinatawag na machine lifting? Tsaka meron din po tayong tinatawag na mga free weights. So yung mga free weights, usually advanced na yan.
Mga barbell.
Oo, kasi kailangan mo ng balance dyan eh. Kailangan alam mo kung paano balansehin yan. Tapos, pagka kasi machine weights, yung machine, hawak niya yung weights. So, hihilain mo na lang. Oo. So, assisted ka. So, mas safe yon from injuries to your joints and to your muscles as well. So, usually we start off with mababa muna, pataas ng pataas, hanggang sa kaya mo na. Oo, ganun.
Doc,
What is the effective heart rate for a cardio exercise? Kasi sabi ng iba, you have to at least reach at least 150 beats per minute and sustain that for 15 minutes. And then you'd have a good cardio exercise to expand your lungs and to get a...
Well, according to American Council on Exercise, for the formula, we do 220 minus your age equals your maximum heart rate. So that's from American Council on Exercise. I'm also a group fitness instructor.
yes, kaya alam na alam mo yan, Doc. Doc, last question na lang, no? Gaano kadalas dapat mag-exercise ng isang tao? Dapat ba everyday to? And if everyday, gaano katagal in a day? At least an hour ba?
Okay. The question is kind of deep because the frequency of the exercise depends on what you want to achieve. So if you want to achieve endurance, you have to do it on a daily basis. If you want to develop strength, you have to do it 3 times a day. 3 times a week pala. Oo. And then if you want for health lang, for simple health lang, you can do it once a week naman. Pero I really would recommend a daily basis kasi you're trying to develop a habit eh. What I'm telling you, the frequency that I'm telling you is kind of an old school eh. So you tell your clients, like kunyari personal trainer ka, doctor ka, you're trying to help this person develop some exercise habits. Kung gusto mo talaga mag-develop ng exercise habits, gawin mo yun araw-araw.
Yes.
Maligo ka araw-araw.
Habit yun.
Mag-toothbrush ka araw-araw.
Yes.
Gawin mo yun on a daily basis. Not necessarily that you need to stay and exercise so much. You just need to just do it.
Para mag-get used din yung katawan mo, yung
habit
system mo, at
lang
hanap-hanapin ng katawan
Exactly.
mo.
Pag hinanap-hanap na ng katawan mo, you cannot do without it anymore. Parang cellphone.
That's right.
Dapat hawak pala.
Ay, ang dami natin natutunan mula kay Dr. Emely. Dr. Emely, if ever we want to consult you for further details or meron kaming gusto nga matutunan mga exercise, saan po ba namin kayo mahanap?
Oh, okay. By the way, I'll just make a little bit singit pala. I forgot to discuss pala. with regards to calling me and contacting. So because isa pang bagay kung paano makakatulong, isang kumbaga support para makatulong dun sa mga busy people. Are you aware that we already have treatments that you can just sleep and then the clinic will work it out for you? May mga gano'n na tayo at may mga gano'n akong patients na nakahiga na lang sila, tulog sila, that's their sleeping time and lunch break time and relaxation time. While they are lying down, the treatments will be done to them and then when they wake up or they stand up, they have already lost at least 10 to 20 centimeters. That's body sculpting and body contouring. So that's how we can also manage.
Saan namin mahanap yung doc? Saan po ang clinic ninyo?
Okay. We are located at Unit 2H, second floor, mezzanine level, the Grand Hamptons Tower 2, First Avenue, corner 31st Street, Bonifacio Global City, Taguig. Our numbers are 843-3023. It's called the Vine Holistic Medical Aesthetics.
There you go. Ay, minsan punta tayo. Subukan natin yung sinasabi ni Doc.
Yan!
Parang exciting
Oo.
yan. Thank you so much, Dr. Emely Sevilla.
You're always welcome.
We learned so much today and hopefully masubukan namin yung sinasuggest mo one of these days. Thank you so much. Mag-exercise muna tayo. Parang gusto ko subukan yung stretching.
Kailangan mo yan.